trust has never been a big thing to me like it has been in the health insurance space. I have engaged a number of CEOs in the health insurance space. And what I can see is that there's no trust and all that. And that's one big problem that the health tech space still has. Data existing in silos.
So are you saying if insurance payers were to be collaborating and sharing data with each other, we can have a centralized...
Do you know what that can do? Now, inflation has happened. There's medical inflation, which is one of the major drivers of inflation in Nigeria. Sure. So anything that's to do with offering goods and services in the healthcare space has to come with you're buying inventories, you're buying drugs. Drugs is like crazy right now.
So you're saying it's about the consumables.
Yeah.
How about the service part? Is there inflation there?
No. Medical inflation is not driven heavily by the cost of this service costs, like maybe consultancy fees and all that. I don't think the physicians are actually the ones driving the cost. It's more of drugs and consumables that are imported.
Hi everyone, welcome to Health Echoes. I am Dr. Kike Oduba, and I have here with me Dr. Dami Adeyemi Levite.
Hi everyone.
A very good friend of mine, but he is a physician. He's also an entrepreneur. He's an investor and a finance expert who has, done several things in healthcare, fintech, insurance, and he also advises and mentors startups in those fields. Welcome to the show.
Thank you very much, Kike.
Thank you so much for joining us.
Yeah, same here. Thank you very much for inviting me because, I'm excited to be here.
Absolutely. I'm even more excited because I haven't seen you since
I think last
2
December
years
23.
now?
Yeah.
Yeah. 2 years. Well, it's great to meet you again.
Yeah, it's okay to give high five, right?
Absolutely.
Yeah.
Absolutely. So I have so many questions for you, Yemi, but let's start from where it all began, right?
Okay. Yeah.
You and I met in medical school.
Back then,
I know.
many years ago.
I know. You were always tall anyway, so I didn't watch you grow, but I've seen you grow in so many aspects of life. I've seen you grow as a professional, as a doctor. I've seen you grow as a minister of the word.
Glory to God.
I remember you used to minister
I was going to say glory to God some time ago, but I was holding it back.
Don't hold it back.
Okay. This is health tech, not church.
Oh, I know. But the thing is, our faith and our belief system pretty much shapes how
seep into every aspect of our lives.
And I think you and I met when we were in fellowship back then.
Yeah.
You were
CFG.
Exactly, CFG.
Yeah.
And so you used to have a lot of thoughts around how young people should grow. I remember us having conversations around our careers.
Mm-hmm. I remember very well.
Yeah, I know,
very
right?
Well.
Things were not clear then. We didn't know if we were going to be in Nigeria. Some of us were thinking of going to the US, doing USMLEs and all of that. I, for one, have a story behind how things panned out. Wow. And I'm sure you also have stories on how things panned out. Let's start from each other's sets, right? In my class, maybe there were like 150 folks. I don't think there's up to 10 to 20% of our class left in Nigeria.
Yeah.
And I think you can say the
same,
right?
same thing, yeah.
Okay, great.
Yeah, same thing actually, because I remember very well we were trying to do a reunion then, and it was like going to be a UK thing.
Yeah.
Or a US thing.
Yeah.
More than a Nigerian stuff. And I'm like, wow, that's interesting.
Yeah.
A lot of people have left. My wife is a physiotherapist and she actually has the same kind of data points to like a lot of her classmates are in the UK right now, or US or Australia or something like that, or Canada.
Wow.
Yeah.
But you stayed.
Yeah.
All right. Tell us about how your journey has evolved to what it is today, from medical school back to youth service.
That's going down memory lane, actually.
Yeah.
And it's a sweet story I always like to tell because, like you said, our faith should seep into every aspect of our lives. For me, I've never done anything that I wasn't clear that God actually wanted me to do, even down to staying back in Nigeria when everybody was jackpying and all that. And I can remember very well while I was in medical school, 300 level. And I was praying to God and I'm saying, God, there was a roommate I had then was my senior. He was in final year medical school. If I tell the story, you probably would know. And he said God told him to leave medical school. And I'm like, God, see, me, I am in 300 level. I don't have to finish. Tell me, do you want me to finish this journey or you have something else for me to do? And God actually asked me to finish, but I wasn't going to practice. Mm-hmm. But I wasn't sure what it was going to be. So in 400 level started getting clearer, like when God is opening the eyes of a blind man and you say, I see men as trees, that kind of stuff. In 400 level, I remember, if you remember, I did something about entrepreneurship
I do.
and we set up something in New Great Hall,
Yeah.
brought people who knew how to do stuff, how to sell,
Yeah.
whatever service you're offering, come and sell. I remember that Lakon Lane then came in. A lot of people actually came into New Great Hall, and then
Yeah.
when I was done, I was broke. I was in debt, but I was happy.
Yeah.
That was one of the biggest moments of fulfillment for me.
Was that your first
That was my first
venture, like
yeah,
doing something?
doing business. Yeah,
Wow.
that was my
Okay.
first. Before
In
that
medical
time,
school.
before that time, it has always been, oh, I probably just as a music director or go and play somewhere in the
Yeah.
church and I get paid, or I enter a studio and I just play the bass guitar for some people.
Yeah.
And just get paid. That's the best I had done when it comes to working for money. But in
Yeah.
terms of setting up something like a business, that was the first.
Wow.
There was no gain, no profit, but I was happy. I was happy seeing people doing business, medical students doing business. It was fun. And then since then, I knew that there was something big about this journey that God was taking me through. So, final year, it became clearer that I wasn't going to practice. Started praying what exam. Bengalade Jovi was writing ACCA.
I
Yeah,
remember.
he was in class now.
I do
And as at
remember.
that time, I think he was already done, almost done. I was
Yeah.
like, wow, medical doctor, chartered accountant.
Yeah.
And I prayed about it, and God said, go ahead. One striking thing that happened while I was actually preparing for ACCA was that God told me, don't go for any lectures. I'll teach you finance myself.
Wow.
I'm telling you.
Okay.
First few days I carried those books, F1, F2, F3. I was like, God, please, are you mocking me? What's all this? Like, it's impossible. And he said, I want to teach you secrets of finance and how you can actually do very well in it. And I actually yielded. I started carrying the books, started reading. First exam I did, I scored 72. Second one, I scored 66. I'm like, God, see, I hope it's not a downward trend. And then the third one, I think I had 80 something. So that gave me confidence after first level that, okay, yeah, I think God is in this truly. So second level, I finished the exams in like 2.5 years. I became a chartered accountant after medical school. It was an amazing experience for me. And since then, I've trusted God for every bit of my career path that I was taking. And I wasn't going to practice, so what am I going to do? I wanted to do banking. So I started applying when I was doing my NYSC, wanted to do banking, applied to all the banks in Nigeria, applied to the Big Four. Big Four said my age was too much then. I think I was 27 then, going on 28. So they said, oh, I'm too old, it's 25 or younger. So I couldn't enter the Big Four early. And then I met Dr. I can't remember his name now. One of our seniors in medical school. I met him at ARG Lounge that day. And I just said, hey, I don't want to practice. And I really want to do business. And he said, do you want to do health insurance? And I'm like, I've never thought about it before.
Yeah.
And he said, okay, if you're interested, send me your CV. And I sent my CV. They just called me. Dr. Tunde Salako of Red Care called me, had the interview, and voila, I got the job. First
Wow.
April 2013.
What insurance company was that?
Red Care.
Red Care.
Red Care
Oh,
Health
that's
Services.
an
Yeah,
okay.
it was. It's an HMO. Yeah, it's still existing now.
Oh,
That was the
okay.
first. So from Red Care to Novo Health Africa to Life Care Partners, where I met the Reliance big boys. Then they were not the big boys. I remember very well that we just gist a lot about health insurance industry, and by that time, God has actually given me the understanding about why health insurance, because it's all about helping people to be able to access healthcare,
Yeah.
affordability, accessibility. That's like the core of actually of my
Yeah.
career in a sense.
Yeah. Yeah.
So, God started teaching me how to build health insurance products, and I was just gisting with these guys, and I didn't know they were going to set up an HMO later on. So I was at Life Care Partners, and then things were not really going well. We were holding claims. I was having anxiety because everywhere I go, yeah, that's exactly what it was. Because then I was the claims manager, so
Oh, okay.
anytime hospitals are old claims, I'm the one they call.
Yeah.
I just told my boss, like, see, I'm done. I can't do this anymore. So I was done with health insurance. But while I was doing health insurance, I remember very well work that was not my own. That's not part of my JD.
Yeah.
I just jump into it. I started using Excel spreadsheets to analyze claims data. Started finding patterns about disease patterns. Which one we're actually paying more claims for, which one we're paying less claims for. And then before you know it, I started building a model, a pricing model from it.
Wow.
Yeah. And that was not my JD.
Did
I
that
was not
exist
required.
before then?
Well, so people build pricing models,
Yeah.
but pricing models are generally not used by HMOs in Nigeria.
Got it.
Hardly. maybe when we now started it in Reliance, people now started going back to it.
Yeah,
But
yeah.
before Reliance, I don't think people, even when they were doing pricing model, there was like an actuary just comes, tells
Yeah.
you this is the price you should sell your product. They don't even follow it. So most pricing in the HMO market before Reliance came to board and to the market, they were not actually data based. They were not data driven. It was more or less like, okay, this HMO is selling this price, let me sell.
Yeah.
I'll find out later how the claims is going to look like, if it pays me or not. But we used data driven
Yeah.
means of arriving at the pricing, what claims to pay, and all that. So while I was building all that at Life Care Partners, Femi and Okwe walked in. They were offering tech solutions. They were not even in HMO space.
Yeah.
And I remember very well, this is where I'm saying the story because I like saying it a lot. I was going to leave Life Care Partners a month before they came. I got a new job, a finance job, because I said, okay, now I'm a chartered accountant. Let me go and start doing finance job now.
Yeah.
And then these Turkish guys came. They offered me accommodation on VI. I wasn't going to pay house rent. They were offering me good money as at that time. And then Life Care Partners was owing me salaries for like 2 months. They'd not paid. And I said, God, see, I want to go. And God said, no, it's not time. There's a reason why you have to stay back here. So I stayed back. A month after, Femi and Ope walked in, goes, offering those stuff. And we got gisting like this, like we
Yeah.
were gisting just now. And they were just talking about the health insurance space. And they asked me one simple question. If you have all the money in the world, what will you do with the health insurance space? I brought out my pricing model, brought out everything, how I'm going to be paying claims in 24 hours, making sure that whatever issue it is that made HMOs want to be able to pay hospitals, I want to eliminate it, build trust so that people can buy health insurance because the penetration was low. Then it was around 3% of the population. And part of the major problem was trust. People don't trust HMOs that they're going to do well. When they get to the hospital, they have to wait for a longer time. Once they're HMO patients, they don't get treated well in the hospital. And I'm low. I want to build an HMO that once they hear that it is my HMO patient that is in the hospital wants to treat them right now because they know they're getting their money in 24 hours.
Wow.
So I didn't know they noted everything I said. I was just gisting. I even told them, "Ah, I want to go into an MBA." They said, see, you don't need an MBA with this thing you know. I'm like, okay, no problem. So when that happened, that experience was a turning point for my life. And I never knew then. Because after then, I now got a job with an investment banking company. I said, okay, yeah, okay, well, no more HMO. Let me just go. And then 3 months into investment banking, God kept telling me, I just started hearing strategy in my spirit, strategy. And I'm like, strategy from where to where? I told my wife, like, I'm hearing strategy, but it's not making sense. And then by the time these guys came, the only thing they asked me for is, oh, we have money from Silicon Valley. We don't know how to manage the health insurance business because we have not never done it before. You seem to have it all figured out. Your playbook seems to make sense. Let's see what we can do. So I said, okay, I don't want to work with you full time. Can I do consulting? Because this investment banking, I've been pursuing this career for a long time. Now I now have banking, and I say I'm not doing it. God said, leave. Following startups in those times is harder because you don't know where it's going to go. It can blow in your face, and then it's risky, very risky. I still had a call with someone this morning who was telling me how he left Reliance Health for another company, and then in less than a year, they folded up. So the
Because
risk
there's
was
a lot
there.
of
Yeah,
instability in the
yeah,
startup
yeah. In the startup
space.
space, yeah,
Yeah.
the
Is this
uncertainty is too
related
much.
to funding? Because sometimes funding doesn't solve all the problems. Is it a management thing or a product market fit or adoption? What is the main
So
reason why
I think the
startups fold up
two
like that in Africa?
critical factors I think is the major problem are number one, the macroeconomic environment not being so ready or ripe for certain innovations that are coming into the market. That's one. Then two, poor management on the part of the startup
Yeah.
guys. So some founders actually don't know anything about financial management. Some founders don't know how to manage cash when you are at the conceptualization stage, ideation stage, and when you now actually really need to test for product market fit. At ideation stage, some people have already started hiring people. That's a wrong way to go about it. At the ideation stage, you've already started having PA as the founder. You've already started paying yourself big money. You're not ready for business because that's not how it is. It should be more of equity than cash. But some people actually pay themselves good cash.
Yeah.
So that's one problem.
Yeah.
But I think the overhacking problem is that macroeconomic environment. Tech actually grew and blew so well in the US and other thriving markets because the government was actually heavily involved.
Yeah.
They were able to fund innovation. There was no issue with one capitalist thinking, oh, I need my multiples
Yeah.
in 5 years down the line. I want 10x, I want 5x, that kind of stuff. So it actually helped those kind of markets, but we don't have that in Nigeria. Lagos State is trying to do something close to that now by setting up maybe a fund that is going to be for startups, but
Is
even
that the
that,
LS ETF?
I think so.
Yeah.
I think so.
That-
You actually met
Hakeem,
Doctor Hakim.
yeah.
Yeah. So he actually handled that for a while, but that's just like scratching the surface.
Mm-hmm.
Big money has to be poured into it. So that macroeconomic environment also affects how much money government can drop for that kind of stuff, because propensity to buy is there, disposable income. So if you bring in an innovation into the market and the market is hungry, people are being pushed below the poverty line on a daily basis, the propensity to buy is not there.
Yeah.
So no matter how great your idea is, it might just be ill-timed, because that's another thing.
That's true.
Yeah. So I think that's a major problem in the startup space. What was I saying? Oh, how did you get there?
Okay, so we're talking about how you got into Reliance.
Yeah.
There
So
were, yeah.
so the playbook was easy to execute at Reliance because it was like a done deal. I had written all the way it's gonna play
Yeah.
out. The only thing I never knew existed then was that you can actually have a tech team that you would just sit down and start fleshing out all those ideas and executing. And that was what Reliance now brought to the table for me. So it was a big bang theory, kind of like it was a big bang for me. Like I could think about all the ideas, all those models I was building on Excel.
Yeah.
Somebody can actually translate it to
Into
be on the dash,
technology, yeah.
and then you're pricing health insurance products. That was a big. So I went to market with it, and we did a very good stuff from claims management to pricing methodologies. Reliance was just it for me. Like I had a very swell time there because it was like opportunity meeting with time and chance and everything just working out fine. So, yeah, that's how my career has been. And post that, going into Healer was supposed to be like a platform for solving that interoperability problem in the healthcare space. We're talking about data earlier on, when we're catching up and all that. And that's one big problem that the health tech space still has.
Yeah.
Data existing in silos. There's no connectivity. Unlike fintech, why fintech blew so fast is because there's nibs. There was what do you call this guy now? I forgotten the name of this guy
You mean
that did
Flutterwave,
no before Flutterwave, before Play Paystack and Flutterwave. There's another guy. I've forgotten his name now. Is a unicorn now? How will I forget his name? He's not Igbo name like that. No, not Remita.
Or there's this one, the one that does the POS.
Before POS.
Before POS.
I'll remember it before the end of the stuff. So he actually those guys actually paved the way because what they did was they connected all banking platforms together in such a way that you can actually interact. In those days, if you want to send money from UBA to GTB, it's going to be a lot of work. It
Yeah.
can take days. But now in seconds, you get your money.
So are you saying if insurance payers were to be collaborating and sharing data with each other, we can have a centralized...
Do you know what that can do?
What's
Because-
stopping it?
So, very good question. I have engaged a number of CEOs in the health insurance space, and what I can see is that there's no trust. So trust is a big issue. In fact, trust has never been a big thing to me like it has been in the health insurance space, because we could have solved that problem way earlier than we're now trying to solve it. Because you're sitting on data, I'm sitting on data, but because you don't want me to know how much you're making in a year as premium, the only HMO that officially proclaims their figures every year is AXA in Nigeria, and that's because they are listed, right? So you can actually check online because they are listed.
Yeah.
But Reliance is not listed. If I'm not a shareholder in Reliance, I can't know how much Reliance is making per year. I'm not a shareholder in Leadway. I don't know how much Leadway's top line is. I don't know how much IJA's top line is. That alone is a problem. Because what it tells me is that I don't even know how much really, except you now go through statutory requirements that maybe when you are doing your audits,
Right.
government now gets your information to say, okay, this is how much you made in a year as an HMO. But an HMO industry expert cannot really tell that this is how much volume of cash goes as top line.
Yeah.
in the HMO space. That's a big problem because you can't even plan. You can't do population planning. You can't tell, okay, for this premium, this is the number of people that should be able to have access to care. That actually trickles down to how much you should budget for claims. So by the time government is trying to solve the problem, but they don't have that data, that's a
So even the
problem.
government cannot call for those data.
So now the government is trying to do that through the NHI. NHI has tried to do that. Like
Okay.
NHI actually knows the premium that each of these guys have.
Okay.
NHI has over the years engaged actuaries to say, hey, give us the right pricing that we should sell health insurance products so that we can actually implement it on a nationwide basis. But when the actuary gives the pricing, they'll say it's too expensive.
Who says it's too expensive? The government or the population?
Technically, population will say it's too expensive. Government can push it out because it's actually
Population,
expensive.
Yeah.
Now, inflation has happened. There's medical inflation, which is one of the major drivers of inflation in Nigeria.
Interesting. What is medical inflation?
That's cost of medical goods. It's actually skyrocketing. Yeah. So anything that's to do with offering goods and services in the healthcare space has to come with some. You're buying inventories, you're buying drugs. Drugs is like crazy right now.
So you're saying it's about the consumables.
Yeah.
How about the service part? Is there inflation there?
No. I don't think the inflation is being driven. Medical inflation is not driven heavily by the cost of the service costs, like maybe consultancy fees and all that. I think those ones have been stable over the years. On some HMO tariffs, you can still find as maybe as low as 20k, 30k for seeing a consultant, and that has been like that for years. So I don't think the physicians are actually the ones driving the cost. It's more of drugs and consumables that are imported. So when you import, you are actually paying more dollar
that's
for
true.
it.
That's
So,
true.
for instance, some pharmaceutical companies have to leave Nigeria for the same reason because they can't keep up with. Oh, we're importing stuff we're going to use to create
So
drugs
does it
in
mean
Nigeria.
people have more proclivity to purchase drugs that are made abroad?
That was another problem
People
the
were not buying
health
local.
insurance industry has
made.
actually had. Yeah,
Okay.
health insurance industry suffered from that a lot because there's what's called I can't remember what the name they call it then. So there's a branded drug and there's generic.
Got it. Yeah.
So when you go to the hospital and you give an average Nigerian the generic, they say, yeah, fake low for me. Or they're giving me substandard drug.
Yeah.
And so HRs of companies, because if you want to think about the major drivers of premiums that are collected in HMO space in Nigeria, is driven heavily by corporate businesses.
Interesting.
So it accounts for over 90%, if not 95. So it's a big deal. So corporate organizations have their HRs tell HMOs that, hey, we don't want generics again. Anytime they go to the hospital, don't give them generic drug because our staff comes back to tell us that, hey, it's substandard.
Yeah.
So that already makes us more dependent on the branded. The branded are usually more often than not imported.
Yeah.
So that medical inflation we're talking about is heavily driven by cost of drugs and cost of equipment that you have to import. I think government tried at some point to help with that by reducing the tariffs
So they
so
subsidized
that
it,
reducing the
okay.
tariffs for you to import medical equipment and all that. But even as at that, it's still a lot. Drugs that you buy with 5k like 2 years ago, you're buying it almost 40k, and I'm not kidding, like 8x, 7x. Is that crazy? Yeah. Is that crazy? Antibiotics especially. Crazy. So those are the problems that the health insurance industry in Nigeria have actually experienced. But it can be solved. But if it's going to be solved, people are going to have to come to the table
And
and
talk
start
together
putting that data
and
points
share
together to
data.
say, hey, let's share data. Let's even start pushing the prices. So there was a price war when I entered the industry. Till date, there's a price war. So an average health insurance company goes to the market, sells their products, sees that an HMO is cutting their own price, maybe like by 10,000 or 15,000, they will cut their price too.
That's good for the consumer though,
Good, but on the long run, the providers actually suffer
because they don't get paid.
because they don't get paid.
I see.
The math is not mathing. if if you have a situation where you've collected 10 million naira from this company, but when they get to the hospital, because of medical inflation and all that, hospital tariffs have changed from what it used to be to like 5x what it used to be. You've collected 10 million, but you're going to pay more than 10 million back. So in the HMO industry, there's what's called medical loss ratio. So there are certain corporate businesses that we had to say we're not doing again with at some point. That okay, sorry, it's either you we review your premium by maybe like 100% so that we can actually even break even on your portfolio, or we're not doing at all.
So are you saying is the insurance business really profitable?
Nah,
It's
I'm not going to lie to you. It's not very profitable.
So
So, and I think it's not just about health insurance alone. I think it's about healthcare businesses generally, especially in Nigeria. The margins are not so great. But I think those who are really doing the cashing out are the providers who have learned how to brand themselves, and they've done the branding so well,
Yeah. 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 Yeah.
and they are cashing out.
Yeah.
Evercare came into the market like 3 years ago.
Mm-hmm.
But Evercare is already opening in Banana Island.
Wow.
That's something.
Mm-hmm.
I'm sure they are not renting the place.
Mm-hmm.
And to buy stuff in Banana Island is not cheap.
Mm-hmm.
So if you brand yourself well, the providers can actually make good cash. All right. There is this guy that is trying to see how he can actually do that branding for hospitals now. Dr. B something,
Mm-hmm.
and the name of his business is Care One Hospital. So what he does is he goes to hospitals,
Mm-hmm.
try to remodel their business,
Okay.
and then reshape in such a way that when consumers are coming, if you tell them you're paying 2x what you used to pay before, they'll be willing to pay because you can see the changes.
Yeah. Yeah.
You can see that the service has improved.
Right.
Your
Right.
wait time has reduced.
Right.
Quality of drugs you get is top notch. You
Right.
get the best of consultants, that kind of stuff. So it costs some money. So he's doing that, and I think that is going to help the space.
Mm-hmm.
But I know, like I always say, I'm a prophet in this space. A time is coming
Yeah.
when hospitals will be getting digitized in Nigeria.
Oh yeah.
And then VCs will start buying into hospitals.
Oh yeah.
Like you're buying
Not
into a
already.
startup.
They're even buying hospitals up. Not yet.
So maybe not
Not as
like
much.
not so common.
Okay.
Maybe there's only one transaction I'm aware of that is going close to that, but it's not even very close to.
Interesting.
So there was one hospital that was bought. I mean, confidentiality, I can't say it here.
Oh, yeah.
But there was a hospital that was bought for like 12 billion naira, like,
Wow.
and that was not full stake. It was like a major acquisition,
Yeah.
but the owner still retained
Retain
some
ownership,
equity.
operation. They still
Yeah, so
operate
it's still
the
operational
hospital.
head
Okay.
and all that. But they bought it for 12. I mean, they paid 12 billion naira to get the hospital, and they digitized the process.
But then, how does this affect the average Joe on the street who is trying to get regular primary care, right? Because
So now
all
that's
these
that. You
venture
see,
capitalists
it's
begin to
capitalism.
buy us,
It's still
then
capitalism.
prices are going. This medical inflation is going to skyrocket, and people will not be able to afford
So
healthcare.
what I think would actually really help the space, venture capitalists who want to do health must have the long-term game in mind and not the short-term multiple stuff you
Let's
want to
try
get.
to
Yeah.
get our profits in.
And then I think the ones that are closest to it, limited partners that might be thinking about that for VCs, maybe like family offices
Yeah.
that understand that, look, there's a
Family
humanitarian.
offices local to Nigeria or outside?
That's another story for another day. How many family offices do we have in Nigeria?
That's interesting. Okay.
Let me tell you, in the VC space,
Yeah.
I have combed certain aspects of VC in Nigeria. I was writing the CEO of an asset management company in Nigeria. I won't mention the name. And I was writing for months to say, hey, people who built the venture space in America, they built it on the crucible of humanity in a sense. Like they put the money there and say, even if you don't get the money back,
Yeah.
I have impacted my
Yeah.
environment.
Yeah.
And so asset management companies in Nigeria will have to begin to think about that.
Impact.
And guess how I got the idea? So I ran a course last year, Oxford Private Markets program. And I could see how the venture world actually is built. It's built on that kind of fund. Institutional investors who are government backed, who are not actually thinking about if the return doesn't come, I'm in trouble. But they are more interested in impact. So that's why impact funding is actually becoming a
Yeah.
big thing now. Because
Yeah.
now people have to think about, okay, aside the returns, we should talk about what we impact. So for the average man on the streets to actually really benefit, somebody somewhere who has the big box, usually government or family offices in Nigeria or private businesses in Nigeria that are ready to do some kind of CSR. So put funds together and say, okay, let's even start funding healthcare startups
Yeah.
and start seeing how we can digitize some experience, because digitization actually helps you to drive down the costs
Definitely.
to a large extent. I remember very well when we started Healer then, our consultation with a doctor was as cheap as 500 naira.
Wow.
Yes. We intentionally did that because we wanted to even validate the model to say, hey, I can crash. Because if you go to the hospital physically, it's like 5K on the average. So 5K, crashing it by 90% to 10%, that's 500 naira. Can we see how that actually takes us? Hila is just beginning to increase that cost recently. For a while, we ran it with that figure. And actually, people were actually getting to speak with doctors, getting drugs recommended for them on Hila platform. And guess what? People are actually going to the hospital like they actually saw a doctor
Yeah.
to buy. I'm going to the pharmacies to
And
get
this
their
was all
drugs.
telehealth, right?
Yeah,
And so you
telehealth.
get your consultation with a doctor,
Mm-hmm.
you get your prescription to go to the pharmacy, and you can even get lab tests
Yeah, in fact, how we
ordered.
built it was like we built it end to end integrated.
Mm-hmm.
So when you're done talking to a doctor,
Mm-hmm.
you can actually sit down in your house
Mm-hmm.
and have a pharmacy bring the drug to you.
Oh wow.
Yeah.
That is
Yeah.
essentially
If you
a
want to run a
hospital or
test,
care
if the
at home.
doctor said run a
A
test,
phlebotomist
a
goes out.
phlebotomist comes to your house,
That's
take the
great.
blood
Yeah.
sample, and then you can actually
Mm-hmm.
get the result of the test from the phlebotomist,
Mm-hmm.
I mean from the diagnostic centers,
Mm-hmm.
and then upload it on your
Mm-hmm.
ELA app, and then the doctor sees the result and uses it to
Right.
prescribe the right drugs. The
Right.
drug comes to your doorstep.
Right.
So we partnered with Health Tracker for the diagnostic side. We partnered with Wella Health
Mm-hmm.
for the drug side.
Mm-hmm.
And it actually worked, and it's still working. In fact, HMOs are now beginning to, that's what I was talking about, like, so why we actually needed to go for HMOs, because HMOs needed to crash their costs.
Mm-hmm.
Their margins are very low, very thin.
Yeah.
So they are looking for means to actually convert. And I was saying it many years ago, but people were not listening. I said, see, a time is going to come when HMOs will start selling virtual plans.
Wow.
Plans that you won't be able to see a doctor physically, but you can actually get care.
Yeah. Care.
And
Yeah.
it's happening now.
Mm-hmm.
Hila is rolling out plans now
Mm-hmm.
that cater for people who are ready to see doctors virtually. You don't have to
Right.
go to the hospital physically, but it's only restricted to primary care.
Mm-hmm.
Some level of secondary care, because once you've seen the specialist the first time, they've examined you, maybe you say cardiologist,
Mm-hmm.
your drugs,
Mm-hmm.
follow up visits should be online. It
Yeah.
doesn't have to be physical. And you can actually get a lot of things done. So I think the trend to affect that common man on the street, HMOs have a role to play.
Mm-hmm.
I know a time is coming when it's going to be very, very massive in Nigeria that you start having such virtual plans because it will crash the price.
Mm-hmm.
It will crash the price to a large extent because if you're paying 5K for physical visit or you're paying maybe 1K or even 2K for virtual visits, that's crashed your cost by 60%.
Wow. Wow.
That's a lot.
Wow.
And then another thing we used to do a lot in Reliance then was we used to do a lot of data driven decision making. Like we're not running the HMO business like some other HMOs were
You
running
had
it.
strategy based on data.
Yeah. So part of what we did then, I remember, was to find out what's our major driving costs when it comes to claims.
Mm-hmm.
And I can say this now because it's now open knowledge that in the industry, people are now doing that data analytics to
Yeah.
find out.
Mm-hmm.
And what the industry now knows is that majority of all the claims, what we even thought it was like maybe big surgical
Yeah.
procedures. No, consultation.
Mm.
Consultation was a major driver.
Mm-hmm.
Consultation is linked more to primary care.
Mm-hmm.
Primary care drives about 50 to 60%
Wow. Of
of
healthcare
all
costs.
healthcare encounters, first
Oh,
of all.
okay.
Now, the encounter, that's one, and drives about 40% of the costs.
Interesting.
So imagine that kind of number, and you're now crashing it selling virtual plans. HMOs will have some air to breathe in more because there will be less money spent on consultation.
Mm-hmm.
Then they can even now consolidate more on wellness, which is another part that HMOs are beginning to think about now to say, hey, is there a way we can crash our costs by being proactive?
Mm-hmm.
Instead of them to get down with malaria, can we give insecticide treated nets? Instead of them to get down with hypertension, can we do lifestyle modification courses that they can actually run? And just
Yeah.
send one of our staff to their offices every time to say, hey, this is how you prevent
Diabetes,
diabetes. This is how you
hypertension.
prevent that
Yeah.
hypertension. For instance, I have done it for myself and I know it works.
Mm-hmm.
There are certain foods you don't eat. If you don't eat them, you won't come down with some of these
Yeah.
things. My
Yeah.
BP last time I checked was like 103.60 something.
Mm-hmm. Mm-hmm.
So I made sure that I tested it on myself, tested it on my wife. It works.
Mm-hmm.
So now there was a point that I even was creating something like a kind of a wellness consulting
Yeah.
stuff for some corporate organizations.
Yeah.
So that I don't have time to execute it. I don't have time. There's so many
There's
things in
so
my head.
much
Yeah, so
opportunity to
much, but
do a lot of good in healthcare in
Mhm,
Nigeria, but there are so many bottlenecks as well. And I think it starts from the ability of consumers to access, right?
mhm,
And also to be able to afford some of these services.
mhm.
So, in your opinion, like you said, you're a prophet for this industry, and I'm definitely buying into that, right?
That's great.
In your opinion, do you see a time where the average Joe, because those are the people that I'm really
Yeah,
concerned about,
yeah.
they make up more than 90% of the
Yeah,
population.
that's what it
The
is. Yeah.
people who actually can afford Even 3 square meals
They're
in
not
a day
much.
are not much
They're
in
not
this
much. Even two
country.
square meals in
Even
Nigeria
two
now.
squares, like people are hungry.
Yeah,
People
very true.
cannot afford food. Talk less of medication when they're sick, right?
Yeah.
And so, do you see a time when the average Joe on the street can literally open their phone, get access to a doctor, be able to get their lab tests and their medication without having to travel a long distance, number one, and be able to pay for it using potentially other means that are not particularly financial?
So the first part of that question is a big yes.
Mm-hmm.
It's happening
Mm-hmm.
already. Virtual care is gaining grounds in Nigeria more than before.
Mm-hmm.
Like I said, I mean, I have data points telling me that HMOs are jumping on it right now
Mm-hmm.
because I mean it's going to crash their costs.
Yeah.
But that part of without having to pay the money
Mm-hmm.
is the only part that there's a yes and there might be a maybe.
Okay.
The reason why is because no matter what, somebody has to pay for the care.
Healthcare.
Somebody has worked at the beginning parts to crash the cost,
Mm-hmm.
but the little cost that is still going to come for you to bear, somebody has to pay for it.
Mm-hmm.
So I remember very well then, there's this NGO that I partnered with then from medical school days self, Life Crown Foundation. And I remember then that I was going to sell Reliance health insurance plans to the NGO.
Mm-hmm.
I sell it like I'm selling a commodity to you.
Mm-hmm.
It's like commoditizing health insurance.
Mm-hmm.
To say instead of me saying, okay, you have the names of people that you want to buy it for
Mm-hmm.
directly, let me sell it to you like I'm selling packs for you or
Like a bundle.
vouchers
Yeah.
for you. And then you go to villages and you give to each of them. The only thing you owe me is when you have actually sold, I mean, you're giving it to them.
Mm-hmm.
You have to give me their data points because when they're accessing care, I need to be able to manage their claims. I need to be able to pay the providers that are providing the care.
Mm-hmm.
In fact, some other HM, we're going to even set up a system where we are actually going to be the provider
Of the healthcare
of the healthcare
delivery.
delivery.
Yeah.
But there was a problem with that. I think there was a problem about regulatory bottleneck then that the regulator says, oh, you can't be an HMO and also be a
A
provider.
provider. Oh, does AXA Manta not do that?
So
Don't.
now what they did, so a lot of HMOs, and even Reliance has it
Yeah.
as a clinic.
Yeah.
But what they do is they try to make it in such a way that they run the clinics independent. It's like,
Of the so it's a
yeah,
different
yeah, it's like,
business,
so it's
but
like not a
ownership
hold
is the
co.
same.
Yeah, it's not a
Got
hold
it.
co. So it's like, okay, the
But
subsidiary,
then is there no problem
but
of
it's just black.
conflict of
It's
interest?
still black and white. It's still,
Right.
see what the regulator was trying to avoid doing that. It's still what's going to
Gonna
happen.
happen.
But now, I think the regulator doesn't need to worry about that.
Mm-hmm.
You know why? Because you can't actually box all your enrollees into one place and
Mm-hmm.
say, okay, it's only one hospital you can
You
go
can
to.
go
They
to
won't even buy your product
right.
because you have to tell them they have a national coverage. You can go to any hospital you want to go. Gone are those days in the HMO space that when you buy out insurance plan, they will hook you to one hospital and say, if you don't go to the hospital, you can't go
You
anywhere
can't go
else. But
anywhere.
now you can roam.
Yeah.
So those are innovations that are coming
So
to the
there's
space.
already partnerships going on for you to
Yeah.
be able to become an HMO too. So it looks like the HMOs are the ones who own most data. They own data from
HMOs
hospitals,
have a gamut
and
of data.
and so
God.
it's just the problem of them interpreting with other HMOs for us to have that
Yeah.
data bank
Yeah.
that allows
Yeah.
population health to
Yeah.
become more
Exactly.
effective.
So to
Okay.
answer that question,
Mm-hmm.
somebody has to pay. That's why I mentioned that NGO stuff. So if it's not NGO, it can be government.
Mm-hmm.
If it's not government, it can be a private company that says, "Oh, we want to do CSR."
Yeah.
I think once we get to that level where we're commoditizing health insurance and make it like a voucher kind of stuff, that okay, once you buy, just that it's a product.
Mm-hmm.
Tech has to be heavily involved
Mm-hmm.
because all we just need maybe your phone number, your name, and your email address, and then we can say, yeah, you are enrollee. And
Mm-hmm.
anytime you want to access care, this is how to access care.
Have you ever thought about the potential of tokenizing regular daily activities that then become
That's going to happen in the healthcare space. It's just a matter of time.
time? Wow.
It's just a matter of time. When AI becomes full fledged,
Yeah.
um, operational
Mm-hmm.
in healthcare in Nigeria, it's going to happen. It's happening technically, but it's like people
It's
who are
not
doing this thing
really
are like,
adopted
yeah, it's
as
not adopted
much.
yet. Yeah.
Got it.
So
Got it.
people are already tokenizing experiences
Yeah.
in the healthcare space,
Mm-hmm.
but it is at the level of maybe HNIs or something like
Yeah.
that. Like,
Yeah.
so it is manual tokenization now. So, for instance, you bought this plan with these
Mm-hmm.
people, like a wellness plan with this wellness company.
Mm-hmm.
if you don't use it, it's there for you.
Right.
It's not like health insurance that once you pay in a year, that's the end.
I see.
So it's there like it's like a retainership kind of stuff.
So it's kind of allowing people to roll over
Yeah,
their
you can roll over. Yeah,
benefits
yeah. There are people who
continuously
do that
until
now.
they
Like it
use
is.
up.
So the only thing is the company who is the wellness company is only just taking a management fee.
Got it.
So it is if you don't use it, your money is there. But when you want to use it, we facilitate how you see the specialist faster, how you get your drugs and tests done faster. It's transparent,
Yeah.
and that's what HMOs call TPA, third party administration.
Right.
But most HMOs don't like TPAs in Nigeria because the headache can
I
be
think
crazy.
it's all over the world. Nobody likes TPAs.
I almost thought of floating the TPA
Yeah.
company. I remember very well then that I was thinking about it, but I know the headache is going
Yeah.
to be in you're going to have to compete with HMOs.
Yeah.
Because HMOs they okay, you don't need to pay that. I mean, just pay this premium and then you're covered for everything. But
right.
TPA is you're not covered for everything, you're covered for everything. But the way it's going to happen is what you use is what you
What
get.
you get, exactly.
And I think that even works better.
Yeah.
It's just that the flip side is so for instance, I had to buy health insurance recently and I was telling myself like, should I do like walking basis or should I do health insurance? Let me tell you why I bought health insurance. I bought health insurance because health insurance gives me an array of benefits. I can do dental care, I can do optical, I can do delivery, I can you understand
Yeah.
vaccinations and all
A
that.
lot of people. So recently, I lost my mother-in-law, and
Yeah, condolences once more.
thank you so much. And it was preventable, sort of. It was a cardiac event that could have been prevented. She actually had, chest pain or something, but she felt something about her heart wasn't right. She spoke with her, my husband, who was her son, who is her son, and said, I feel a bit off. And so the Monday she went to the doctor's office, so I think a cardiac doctor, and we don't know today what really transpired, but she visited a doctor, and then the next day she passed. Right, somebody who drove herself around town went to visit, different family members. So, point being, this seemed like a preventable event, but what struck me was the fact that we had been thinking of health insurance. So I asked, several family members who has health insurance. Like nobody has health insurance, and I'm thinking
Reliance actually rolled out one recently called
Yeah.
Alafia. I don't know if you saw it. I can forward it to you.
No, I've heard of
But I think it's
the
robust
Ilera
enough.
Eco from Lagos State, right?
Well,
And I hear a lot of hospitals don't even take that.
Nah,
So in shopping for health insurance, it's like
but
even the people don't know
if
about
I'll forward that Reliance onto you. So the reason why I would forward it is because I know that once Reliance pushes out a product, it works.
That's great.
And we actually did a plan for old people then.
Okay.
And towards the end of my stay there, was still working till I left. It was after I left that they stopped it for a while.
Okay.
So for older people, we call them senior citizen plans, and you can actually access care. You can take care of diabetes, hypertension, all
So
this
even
stuff.
with pre-existing
With pre-existing
conditions,
So we've covered 4 pre-existing conditions then.
only for them. Okay.
Diabetes, hypertension, asthma, and peptic ulcer.
And so, do people who have parents who, because I mean, that's my situation now, parents who have chronic conditions, they need help with navigating care and all of that. So, with that, do they assign care managers to these adults? Because many of them cannot they don't even know how to access their health insurance benefits.
Gerocare. I don't know if you heard of Gerocare.
No.
So Gerocare actually takes care of that admin side of
management
managing them. Yeah.
Okay.
So I don't know if he has advanced even to the point of being able to provide people that actually stay at home with the old people.
Maybe not stay at home,
But at
or
least regularly
navigate.
managed, right?
Yes.
Yeah. So I think
Yes.
Gerocare actually offers that. I can actually reach out to him after this.
Oh, yeah,
and
please,
then
because
ask,
that
because-
is a huge need.
Yeah, it's a huge.
Many
gap in
people don't
market.
want to put their parents in old people's
homes, yeah.
home anymore, and it's becoming too costly to keep their parents alive and well, right?
Yeah.
And so there needs to be alternatives for people to be able to help, parents get to appointments, like even get to see the doctor on the phone. My mom had a medical emergency last year. I was I was at a conference. I was in Spain, and I was, with a bunch of other doctors. I had a neurologist, several pain doctors. In fact, I was on a boat cruise. We're having fun, and I got this call that mom needs to be rushed to the hospital. I was like, oh my goodness. And the doctor beside me, very influential neurologist in the US, says, I think this might be a stroke. Can I do a teleconsult with her? Instantly, like a WhatsApp call became a teleconsult.
Whoa.
Immediately, we're trying to assess for facial dysmorphia. We're trying to check for her, brain function. Is she coherent? Trying to check for different things. And instantly, we could make an assessment and say, hey, this is what you need to do when you get to the hospital. In fact, she needs to be in the hospital, like, right now. Point being, if I wasn't there to actually ask the right questions, to find out
so
who
that'd be
needs
terrible.
what, where you need to go, because there was another family member saying, oh, she will be fine, she's just stressed, let's just sleep it off. Do you understand? So we need care navigators to help
Okay.
older people really know how to, seek care, get the care, and even follow up the care plan.
Yeah.
So those are the things that I see that are and many Nigerians are not educated as well. There are still many uneducated
That gap
Nigerians.
is there.
The gap is
That
still
gap
there.
is there.
So many people, there's still the digital divide where so many people cannot even use a
Use a
smartphone.
smartphone. Yeah, very true.
For you to even WhatsApp now has become a telehealth platform.
Yeah.
Believe me.
Yeah.
I've heard of chatbots
Yeah.
whereby people just plant a chatbot inside WhatsApp. You ask some simple questions, and WhatsApp begins to give you
Hila
suggestions.
actually did that at some
Okay.
point. So yeah, that recently that was implemented.
Yeah.
Yeah, so you can actually run your telehealth consultations on WhatsApp.
Right, on
Yeah.
WhatsApp.
For
Wow.
HMOs. Yeah.
Wow.
It's working.
Wow. Okay, let's segue because I know we have so much to talk about, but there's
Yeah,
so
that's
much
true.
time. I want to segue into the healthcare investment side.
Okay.
As a physician, right, you've walked that journey whereby you knew you were not going to practice medicine, but you wanted to go into finance, you did insurance, and now you're an investor, right? There are many doctors out there who are looking for a way out of the country, out of the profession, out of the lack of financial, incentives for the work, the good work they're doing, right? So what would you tell a doctor who is trying to follow the same path of, I do not want to practice, I want to leave or I don't want to leave, but there's something else I want to do to impact healthcare, but I don't want to do bedside medicine?
Let me even shock you with this good news. Do you know that medical tourism in Nigeria is growing?
Interesting. Like people are traveling back
People
to
are
Nigeria.
coming. I know people who came from Canada to come and see a child psychologist in Nigeria.
Interesting.
I know people who came from Canada to come and do surgery in Lagos, Nigeria. People are beginning to calculate the cost.
Yeah.
Because now it makes more sense to take your dollars in the US and come to Nigeria and get, I think one of the craziest surgeries you can do is to maybe do like maybe an hysterectomy, right? Hysterectomy in Nigeria, if you have 2 million naira, you get it done.
Oh my gosh. That's
In a very good hospital.
really cheap.
And that's really cheap when you convert it to dollars.
That's
in dollars,
about
that's like,
400, roughly, right?
is it up to? Yeah, maybe like
Around
that.
1,400.
But I'm sure if you want to do hysterectomy in the US, you will
That's
spend so
a
much
lot.
money. So let's even add your ticket money. Another 1,500 max. That's like $3,000.
Yeah.
$3,000. You will do a lot with it in Nigeria when it comes to healthcare.
Absolutely, because I'm thinking of copays and deductibles before those even kick in. I mean, before your actual insurance kick in, you have to pay those, and that could be up to $5,000.
Exactly.
Right. For
So
someone.
you crash your cost.
Yeah.
One, use it to see family. You spend time with family more. You're in Nigeria, man. This is your country. You'll be happy you are here. It's like nobody's going to be looking at you with one eye and say, hey, sorry, you're not part of us. You just have our passport or something. Now, why did I say that? I have spoken with a forum of doctors before, and I've told them one thing. That, hey, you guys are sitting on a gamut of opportunities that you don't even know about. If I'm not doing venture capital that I'm doing now, I'm not doing healthcare investments that is in the area of maybe VC or tech.
Yeah.
I will just look for another like-minded doctor who is a specialist, maybe a surgeon, and I will set up a place. And all we're just doing is any surgery, bring it there. Because if you begin to run out of the country, the amount of money you're going to spend writing exams, doing this, doing that, if you put that money together in Nigeria and set up a facility for yourself, people are coming back. It's just by law that you're not required to charge in dollars in Nigeria. But even if you charge the equivalent of the dollars they would have paid if they were there, or even less, you make a lot more money. All you just need to do is brand yourself well. Let people be able to trust that, yes, you know what you're doing.
Yeah. I have a few colleagues
we
that
use
traveled from the US to come and set up here.
yeah.
Like they're moving back to
Yeah, there's a
Nigeria.
doctor that actually works with John Hopkins. I can't remember the guy's name.
Oh, is it orthopedic surgeon?
Yeah.
Oh, I've
Is
forgotten his
he
name. He
came
came.
back.
Yeah.
I was telling some of my friends, like, hey, this guy,
Can
some
you look
people are
him up?
seeing
Can you find
things.
his name? Yeah, I want to
I've
spotlight
forgotten his
that
name
doctor.
now.
Yeah. He
Oni
wears
is
but
is
he
Shegun
wears
Oni. He
I
wears
think
bow
so
tie.
bow
I think
ties.
it's Shegun
Yeah.
Oni or something like that.
Yeah,
It's
yeah, yeah.
something Oni.
Yes.
And I looked at him like, see, this guy is a sharp guy. He
Yeah.
left John
He
Hopkins,
knows what he's
an
doing.
associate professor. He knows that okay, on the long run, Yoruba will say Lela boy Simioko. Like no matter how you go far, you want to come back
Yes,
home. When you
definitely.
come back home, you must have an investment that is working for you.
That's right.
So what I tell people is, if you know that you actually know your onions in Nigeria,
You'll be successful.
you'll be successful.
Julius Oni.
Julius Oni, I know it's something Oni. You'll be successful because on the long run, all you just need to do is brand yourself.
Yeah.
Get if you don't know how to do business, leave the business side for me. I will help you run it. I will set up your facility for you. I will set up all your documentations for you.
Yeah.
I will even help you do marketing. You
You are
just be
hearing
there.
now,
You just
audience.
sit down and be seeing the patient. I will bring the
Dr.
patients to you.
Yemi will set up for you.
I told them like it's that easy.
But what is the investment cost though? Do you invest in doctors or just technology people?
So,
Like, what kind of people
okay,
do you
let me
invest
use cardiology for instance. If you're
Okay.
a cardiologist in Nigeria, now you don't need more than 10 million naira to set up your facility to start.
in? Really?
Yes,
Wow.
you can get a very good, maybe 3-bedroom flat somewhere. Just make sure it's a choice area. Maybe 3 million, 5 million takes care of that. Maybe another 2 million or thereabouts to set up the whole place, make it look neat. What people need when they come to your hospital is your brain
Yeah.
and your stethoscope.
Right.
As a cardiologist, you don't have to have echo machine yet. You can refer people to echo clinics. You can refer people to go and do their whatever cardiogram, ECG. Let them go and do it somewhere else. But when they bring the result, let them have that confidence that I know that this guy knows his onions and he's going to interpret this result and treat me the best way possible. You don't actually really need gadgets as a cardiologist to start. The only thing they need is your hand and your brain, and you have that already. Set up the place, make it look cozy, and say, I'm a cardiologist. Mention the name of the clinic. I will set up how your patients will come to you. Now, people don't want to think about that because sometimes when they tell you, oh, I have this 10 million naira, I can use it to jackpot now.
Uh-huh.
But what you have is in your hands.
Yeah.
You can sit down at that cardiology clinic and patients will be coming to you. What's the OPEX you're going to have? Your operational expenses. You're the only one that see. Maybe you get a nurse to be doing vitals.
Wow.
Start from there. You don't need too many people. Maybe a front desk just because of ambience and you want to make it look like, okay, this is professional.
Yeah.
Guess what? I know a doctor, a senior doctor who left Nigeria. Who does that in Australia? You must know him. What's his
Oh, I
name?
know him. He's a
Dr.
neurosurgeon.
Borire.
Borire. Yeah,
He has his own clinic.
I know.
There was
And
one day he
he's
was showing a video
consulting
of
and
his
coaching
clinic.
as well.
I saw the video. I'm like, this
Yeah.
is how many people are working here? Maybe like 4 or 5.
Yeah.
And this guy is seeing patients. You can do it here. If I were a cardiologist, and I know that's all I know.
How about in primary care though? What are the opportunities in? Because that's where the most need. That's like the front door
Exactly.
for you to even
So
get
I mean,
to a
so for instance, if
cardiologist
you
or
before you become a
nephrologist.
cardiologist, even general practice.
Yeah, just general practice.
So general practice is a bit trickier because in general practice, when people think you're just a clinic and not a hospital proper, that people can come maybe in the night or something like 24 hours service, it becomes trickier. You can still build your clientele base over time, but I think it's harder because you are not seen as a specialist. You're a GP.
Interesting. Okay.
So when they come to your hospital and they don't think that, if I want to come on Saturday, I'll still see this person there, or Sunday evening, they might be like, okay, let me go to the hospital that anytime I go there, I'll see somebody. When we set up Reliance Clinic, we had that challenge at the beginning. Like people not even saying, people saying, this is not a hospital, so there's no admission. I'm not sure I want to go there. But with time, people go used to it. So it's a longer journey to set up a clinic. It's cheaper to set up a clinic too because you don't need so much money. But the only thing that makes it different is maybe you want to do ambience, you want to start setting up the whole place, you want to have stretchers, maybe you want to examine patients. By the time you do all those things, you can be spending some money. And that's like if you're doing it because when you do primary care, you're not expecting one person like a cardiologist expects per time. You probably be expecting like 10 people coming into hospital almost at the same time. So you have to prepare for the space. So it's actually a bit harder to run the primary care stuff alone.
Got it.
But if you actually want to do primary care also, which is what most hospitals use to actually maintain themselves, then you are thinking of a bigger money. even like a 20 million, like a 25
So it's
million.
actually cheaper as a
It's cheaper as a
specialist. So
specialist. Because
wow.
let me tell you what specialists don't even know they have. They already have that. You know, in Nigeria, we are very big on respect. Or, this person knows what he's doing, so I'd rather pay somebody
Yeah.
that knows what he's doing. So you already have that respect that you're a specialist. You have that technical know-how
Yeah.
already.
You're a subject
In
matter
fact,
expert.
some people even go as far as you can go as far as saying, "See, my own is virtual. I come to your house physically once or twice, and then we run the rest virtually." That one, you don't even need a million.
Wow.
That one, see, and I don't think there's anything wrong. The only law that forbids you from advertising is to say, "Hey, I'm the best cardiologist in town."
Interesting. So now you can advertise as a
You can
doctor in
you can actually.
Nigeria. How do
What are
you?
people doing on LinkedIn?
Oh well,
This
I
advertisement as a
guess.
doctor, man. So the doctor sits down on LinkedIn and says, "I'm a cardiologist and neurocardiologist. I mean, a neurophysiologist or whatever name you call yourself." That's branding on its
So,
own.
in your opinion, to get people to grow their practices locally, they just need to set up a small hub
You don't
where
have
they
to
can.
start big.
They don't need to
Yeah.
start big.
Let me even tell
And
you
would
another
they
layer I
make
even
the
go.
same level? Would they have the same level of success though if
Now,
they were
let me even
to?
tell you another level I even take them to. Maybe that will answer this question. Is to say, if you don't want to do it alone or you're scared, let me help you. One. Then another thing I also said was find people like you, two or three.
And
The only
partner.
and partner.
What kind of help do you render? Is it about the setting up? Is it in the
So I can I
funding
can
or
I can set up. I
operations?
can. It's more of strategy.
Okay.
Where do you want to locate? What services are you offering? What's your unique selling points? I can
Okay.
help you put all those things together.
Okay.
I can do your business plan and do the business model for you. You need a business model,
Yeah.
no matter how simple it sounds.
Financial
Yeah. Then
projections.
financial projections, I can do all that for
Yeah.
you. You don't have to spend so much money doing that. Do you understand?
Yeah.
Then again, when you're not done with that, you can now start asking yourself. I think the major critical question when we're talking about the partnership is who has the same vision as I have. Because human beings, when you start business, that's when you know that we are different
We're
in
so
how
different.
we are seeing things.
Yeah.
Somebody probably wants to take his own for another 5 years before he starts reaping the benefits. Somebody might say, I mean, I want to start cashing out now. There's going to be a clash.
Yeah.
So you have to look for people of like mind,
Who
same
have
value
aligned
systems, who are
values.
aligned in terms of
Yes.
what they want to get. And then you start.
Interesting.
Yeah.
So let me ask you another question about being an investor in healthcare.
Yeah.
I know some doctors who have been successful, but they're looking for something else or some other ways to impact the industry. How can they begin the journey of becoming an investor in healthcare? Because I feel like that's where we have the most challenges, right? The
So,
funding of healthcare is still very
yeah.
porous. I
Yeah.
mean, it's still very small, and there's a lot of challenges accessing that funding, right?
Yeah.
So, for
Yeah.
those who want to start, what do you need? What do they need
So
to
what I
do?
always tell people is when it comes to investing, there's always a knowledge gap. It is not putting your money in fixed income and you're sure of what you're gonna get. It's not putting your money in real estate
Yeah.
and you know the rental income you're gonna get. Right? It is putting your money in something that is highly volatile. It's equity. You can fly off the handle and that's the end. You don't see the money again. Whatever you use it for, you don't. So you have to actually be schooled. So I always tell people if you want to actually be an investor, there are certain angel investor networks you can join. There are certain courses you can take on investments. They're very nice. I did Dream VC last year, for instance, because I
Okay.
knew I was going to investment. So I had financial knowledge already. I know how equity works, but I still wanted to mingle with investors for two reasons. Number one, for knowledge gap closure, then two, for building a network.
Got it.
Because there's what's called co-investment. So
That's
if
right.
you actually want to be investing, you can't invest alone. Because when you're actually doing your deal analysis to find out if this business you want to invest in is viable, this startup is viable or not, you need analysts to actually help you check.
Yeah.
So you have those angel networks having enough analysts they work with that helps them to actually check if this business is viable or not. They check a lot of things about the marketability, profitability, all those kind of stuff, business model, the founders, do they make sense?
Yeah.
You have to be trained in that. If you're not trained in all that and you just want to carry your money and say, I'm an investor and you want to start investing, you will head boot too.
Okay, let
You
me
will head
ask you
boot.
this.
Yeah.
Because, I mean, I've started a few companies and I've seen that business is very risky, right? So,
Highly.
and there are a lot of investors who have the money, but they are risk averse. So, from your experience as being a founder, an advisor to founders and businesses, and also being an investor, right? How do you begin to de-risk a startup? Let's say you've built a relationship with the founders, you know the idea is great, but the business model is still very shaky. There are still some issues. What are the steps to de-risk a startup, especially in healthcare, that can help bring more successful ideas into
So you
market?
can de-risk at different levels.
Okay.
You can de-risk at the level of the board if you have a board.
Okay.
You can de-risk at the level of strategic management. You can de-risk at the level of operations. So let's start with the board. So if you want to de-risk at board level, there are certain terms you have to put in your contracts when
Term
you're
sheet.
investing. So for instance, there are certain things that they can't do until they hit this particular milestone. You can't pay yourself this amount of money until you hit this particular milestone. Or if you don't actually stay till this number of years on the startup as a founder, you can't have access to this kind of equity, even though you are the founder.
Yeah, 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 yeah.
So that's a level of de-risking, right? There's another level of de-risking in terms of control systems, financial control systems, like
Governance.
and governance, like corporate governance. You because there are some founders that are very reckless. Some are very shady, reckless. What they're telling the investors is different from what
What's
is
really
actually happening.
happening? That's right.
So, at that financial control level, you want to be seeing financial statements, you want to be seeing management reports on a monthly
Investor
basis,
updates.
investor updates on a regular basis,
Yeah.
and not just seeing the reports. You are testing.
Vesting. Yeah, vetting it.
Yeah, testing because people send reports and all they are sending. In fact, there was one particular one when I was in my program. I did two investor accelerator programs last year actually because I always just speed up my learning process. And one of them, the person that was actually a co-founder of one of the startups, I won't mention the name now, that actually collapsed in Nigeria. It was in news, big news. She was telling us how that her co-founder, who was the CEO, was siphoning money officially, and he would have legit things written on financial statements. And if you just check financial statements, you'll see it there that this is exactly what they said this money was used for, but that's exactly not what it was.
Yeah.
So people stealing money, siphoning money. So financial control. If you are waiting for 1 year before audits, it might be too late. So you probably do like quarterly audits.
Yeah.
Just verify that these transactions are real. Verify that the number of customers that they have is real.
True. The number of users.
Number of users is
on the
real.
platform.
Number of transactions real.
Right.
All those kind of things. Especially if you don't know them before and you've not built trust.
Relationship.
Yeah. So over time, if you've built relationships and everything is clear, then you can now start softening that and start giving them more power. And then if you give startup founders more power at the wrong time, it will burn the whole stuff down. So they have to end the trust.
Yeah.
And from day one, I like one guy, I've forgotten his name, but is the fund manager, I mean the GP for Echo VC.
Okay. Is it a
Echo something, yeah,
Nigerian-based
yeah.
VC?
Nigerian based VC, Echo
Okay.
VC. And okay, I think the guy is based in the US now, but Echo VC was in Nigeria for a long time.
Okay.
So he was saying something about founders are complaining about him that he's too harsh, and he said, "See, why I'm being perceived as being harsh is because I'm following due process that they
Yeah.
follow in a sane climb.
He's doing his
You
due
don't.
diligence.
It's due diligence,
Yeah.
and then I'm asking you, okay, this money you spent, what did you spend it on? And you're saying I'm asking too much questions. Now me carry money give you now, so you have to really really
Right.
you get. Even at Hila, I remember very well. Part of when I was leaving, part of why it was easier to actually manage the whole process was because I didn't mismanage any fund.
Right.
If I mismanaged fund, it
How
would have
much
been
did you
tougher.
raise for Hila?
So initially we raised 250K
250K in dollars,
initially
right?
in dollars. Yeah,
Yeah.
yeah. Then again 300K. But
Okay.
300K was when I was exiting.
Right, right, right. Wow.
Yeah, so imagine if I mismanaged the fund.
know.
Because the guy actually asked he asked for all the statements, he saw everything. In fact, when I increased one person's salary, he flagged it.
Of course.
Like, why did he flag? And we're like, oh, this person has actually been short paid for a long time.
Yeah,
And I
and
felt
now
like,
they
okay,
need-
now it's a new year, it's a new. But even as at that, in retrospect, I probably shouldn't have even increased the money.
Right.
Because what I found out is that if your runway is not so far from this thing, don't be assuming that the 300K that we're expecting will come so fast. It didn't come so fast. It came way later. But we were banking on how it's gonna happen.
Yeah.
So that's another thing startup founders need to actually prepare for. Like just that until that money hits your account.
Don't spend it before you have
Don't be
it.
spending like you have money.
Let me
Very
ask you
important,
this. So
yeah.
that's interesting that you said that. Now, for founders who want to raise funding in Nigeria, like we said, funding is a huge problem.
Yeah.
It's causing a lot of gaps in innovation and ability for good products to go to market, right? What are the steps a founder needs to take to be able to raise capital for their startup?
So it's multidimensional, but there's no textbook way to do it.
Okay.
First off, if you're a founder, that's why they call angel investments.
Okay.
Because angel investments is based on an angel that just believes in you,
Okay.
coming with wings and fly and say, "Hey,
Yeah.
I like your face,
Like
I like what you do,
the
and I think I
friends,
want
the
to."
families,
Yeah,
and the
family. Yeah,
fools.
exactly. That's the FFF, right? Yeah. So
FFF.
those three people, they are angel investors at the beginning. So if you have a very strong
Relationship.
relationship capital, it will help a lot. Not just strong in terms of rich people around you, but rich people that believe in you.
Okay.
My uncle invested in Hila. My cousin invested in Hila. My uncle's wife invested in Hila. Do you know why? Because before that time, when they send money to me for me to execute certain things, huge amounts of money in Nigeria, I fix it for them. I send them receipts. They see everything word for word. In fact, it's
So
like my
you're
own is even too
accountable.
much.
So they already built trust with
So
you.
they had built trust with me over time. Like, okay, this guy, I trust him. He can't take my
Yeah.
money away. So when I sold the idea of Healer to them, I mean, I got some cash from them. So that's trust. So if you're a founder and you're not trustworthy, nobody will give you money.
Yeah.
So you have to build trust. Then apart from that, you have a strong network of family, friends, and fools, like you said. Like people who just say, okay, see, I know that this money, you might throw it away, but
Yeah.
see, I just believe in you. Let me give it to you. There are some people that actually give money because of that.
Yeah.
Like, I just believe you.
Yeah.
That even if you are wasting the money,
Yeah.
what you've done so far, a classmate of mine invested.
Oh wow, that's amazing.
Yeah, my brother-in-law invested. Because over time we built that relationship and there's trust. And guess what? Even despite the fact that I'm no more running Healer, every time there's a report and there's a need for me to clarify certain reports, I still put a call through to them and I explain things to them.
Yeah.
This is the phase that the business is in. This is the number of transactions. This is what it means. This is what it means for your money in the next 5 years if anything happens. And then, in fact, I had to give them a word that, hey, if Healer blows, fine. If Healer blows the other way around, any other venture I go into, because you believe in me, anytime I get any other venture and I have equity, I will give you what you
Equity.
truly
Yeah.
actually deserve
Yeah.
for believing in me for Healer.
Yeah.
Because it's just all about trust. So if you're raising fund, trust, big deal. One. Then two, it's harder for you to build, to raise cash in Africa than for you to raise in the US
Yeah. Yeah.
or any other Sena climbs. I call them Sena climbs because they've built an environment for such things to happen seamlessly. But in Africa, it's still a bit,
So let's talk about Africa. So
yeah,
you worked with Healthcap
yeah,
Africa,
yeah.
right? What kind of work did you do there, and how did you guys fix some of these issues around how difficult it was? Because I think I've heard your
Yeah,
founder talk about bridging
majority
some
of
of
the
these
work I
gaps.
did at El Cap was more of fundraising.
Okay.
With fundraising then, so I did a lot of work with setting up processes for how we can actually better document
Okay.
and get. We're dealing with institutional investors.
Yeah.
We're talking to one of the biggest fintech in the whole world. Then, for confidentiality reasons, I can't
Of
say
course.
them.
Of course.
And I remember very well that when I got into into Health Cap, the first thing I did was to even standardize the process of even relating with them. They are highly document oriented,
Yeah.
and we have to produce documents for them.
Right.
So we have to start working on documents on the TCs, updating the pitch deck, updating so many other documents that for previous funds that have been repatriated to investors, that kind of stuff, or
Right.
returns that have been done in the past. So we have to do all that documentation. Then in terms of operational expertise, I actually brought operational expertise to the table too at
Yeah.
Health Cap. So at Health Cap, I also worked with the team members, creating a system around reporting. I'm big on data. I believe strongly. In fact, I remember very well then that part of the problems we had then was we're getting LPs, but
Yeah.
we're not converting.
Yeah.
What's the reason? So we had to do data analysis to
Right.
find out why we're not converting. You know, fundraising can be tough.
Oh yeah.
Yeah, and then apart from fundraising, another thing I did was portfolio support.
Okay.
So portfolio support, operational expertise, and fundraising proper. So
Right.
those are the three things I did. And then before that time, I was a venture partner, so I was doing more of capacity building for
see.
the team members.
Got it.
So there were people I mentored. Then we were writing exams, writing ACCA, that kind of stuff. So it was easy for me to, like leadership.
Yeah.
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 So then, what question did you ask again?
how did you bridge the gap of funding in Africa for healthcare and fintech?
So, I didn't stay a very long time there.
Okay.
But the few founders, we finally agreed at the investment committee that we were going to fund.
Yeah.
I remember very well that part of the challenge that we had then was to match the time that we're going to get the fund closed,
Okay.
to when we want to
Deploy the cash. Got it. Got it.
So that was a
makes
big
sense.
problem.
Okay.
So what I did was to first of all manage them. Those we could introduce other VCs to them, because you know that our own fund is coming a bit
Got
late.
it. Got it.
We started doing introductions to
Oh,
other VC partners who actually have some fund that they can actually
They were
deploy.
liquid.
Yeah.
Okay.
So that was actually the way we managed some of them. But the truth is, you can't really manage that thing very well if you don't have your own cash.
Cash in hand. That's
Exactly.
right.
So,
That's right.
but I mean, it's so in terms of managing startups, in terms of funding in Africa and the problems they have, I think the first thing first, me, I like solving problems from the roots. So the roots, I told you I wrote asset management companies last year. I tried to see if I can speak with one or two family offices in Nigeria. I can see that the major problem is that Oyinbos will not want to drop money anyhow in Africa again, unfortunately,
Yeah.
because of the things that have even happened in the past.
Yeah.
Trump's policies are going to restrict that even further.
Yeah.
So we have to start finding money from within Africa.
Yeah. Within Africa and even Asia.
Yeah, Asia is yeah. Some
Europe.
people are going to Japan now.
Oh yeah. There's a lot of money there, and they have some.
Europe. Well, Europeans like keeping their money in Europe.
Yeah.
I was in Paris last year, March, and I remember very well. I went to pitch for Healthtech, and when we're done, out of the 10 LPs, out of the 12 LPs I spoke with there, like 10 of them said, "Oh, sorry, we don't invest in Africa." Immediately I start talking and I said, "Oh, Africa? No, we don't. What's the year Health Cup Africa? You know, it's Health Cup Africa. We don't invest in Africa. We invest in Europe."
Oh wow.
I met a Ghanaian guy there who was based in Europe, and his fund was going to be in Europe. He was getting more attention because it's based in Europe. So it's like Africans need to actually
Invest in Africa.
Invest in Africa. So what I've actually been trying to do while working with Health Cap was to see how we can actually push for local family offices to actually fund. Sent mails, no response. But there are few that were responding, but you could tell that they're very skeptical. It's alternative investments. They're used to real estate.
Yes.
They're used to fixed income. They're used
Or
to
even consumer goods, They
they're used to they're used to all this kind of stuff. Euro bonds. They know this is the amount I'm investing, this amount I'm getting at a
back.
time.
Yeah.
But the idea of alternative investments like private equity or venture capital, they're like,
It's tricky.
it's risky. So Africans need to understand that the funding winter might be here for a longer time. But some people would have to start working on changing the mindset of those who hold the cash. That Oxford program I said I did last year, for instance, exposed me to seeing how institutional investors in Canada, in Australia, in America, in Europe generally, how they influenced how much money is available for funding startups.
Yeah.
They actually heavily invest in it. But in Nigeria, if you go and meet our pension fund guys and say, "Yeah, come and invest in startup," they run away from it.
Yeah.
Because it's very risky. So they have to first of all understand, and then the technical know-how is also very important. Like the fund managers who are managing institutional investments in Nigeria, institutional funds in Nigeria or Africa, are they knowledgeable enough to manage the risks involved in investing in startups?
Yeah.
I'm not sure about that. Then if you talk about endowment funds in the US, how many endowment funds are in Nigeria? What are they even doing?
Yeah.
Those are places where money come out from.
Have there been a thought about kind of what's the word now? Spreading the tentacles outside of Nigeria by Nigerians, building those solutions and then deploying in Africa or in Nigeria in such a way. So they are not essentially like Nigerian companies, but they are, Get what
so
I'm saying?
in Healthcap, I remember very well that when we were trying to solve the problem of currency risk, we actually agreed that part of the criteria we're setting is that any founder we're going to be investing in would have to have that sense of global audience.
Yes.
So you can earn in foreign currency. You're
Right.
not just earning in Naira. Because
that's
Naira
right.
is going down the drain almost every day.
Yeah.
So you should think about products you can sell in dollars that you can earn foreign currencies on that are more stable. So, and then again, Healthcap is Pan-African, for instance. So there are pipeline deals we're already thinking about in Egypt, in South Africa, in different parts of Africa like
Yeah,
that. No,
yeah.
this is South Africa. No, Egypt and Kenya. Yeah. So those two places, we had one or two startups that were already talking to them, and then
Yeah.
the majority of them, what we've been telling them is, hey, start earning in foreign currency.
Right.
So one in Egypt is already selling to the MENA region. So one in Kenya is selling to East Africa. East Africa seems a bit more stable
Yeah.
compared with West Africa
Yeah,
in terms of currency risk and all that, and then
yeah.
North Africa too. So by the time you look at all that, the only way you can actually help is to say, let's diversify.
Yeah.
Have startups start thinking, can I produce a product in Nigeria,
Like a
maybe register in
global.
Delaware, and then start selling to
Yeah.
people in the US?
Yeah. Yeah.
And then another trend, maybe that would help, is that most Nigerian founders who probably have done one exit or the other are beginning to relocate to the US.
Yeah, that's the unfortunate thing.
It's
You
unfortunate,
would,
but I'm
yeah.
I'm seeing a plus in it in a sense.
Okay.
Because on the long run, yeah, it would have been best if they are here and they could be funded from here. But if they see you more often in California, if they can trust you, this thing is about trust.
It's true. Yeah.
So they can still have solutions being built for Africa, but they are living there.
Yeah.
So on the long run, maybe that can also
I
solve
think the likes of
problems.
Flutterwave did that, whereby.
Yeah, those guys are out of the country now. They're not anywhere near.
But it's essentially an African product. I don't
Yeah.
think they're.
Yeah, flour is an
Yeah,
African
it's an
product and it's global
African,
now.
and it's
Yeah.
yeah. So, I think there are so many opportunities for investment. It's just knowing the right people, having the right strategy, like you said, in implementing and deploying some of these things.